Hello, everyone, and thank you all for registering to attend ASCA's National Advocacy Day. We at ASCA are super excited to welcome you all to Washington, D.C., and thank you for taking the time out of your busy schedules to travel and meet with your lawmakers to advocate for ASCs. For those I've not yet met, my name is Maya Kunkel, and I'm the Manager of Government Affairs here at ASCA. I'm joined today by my colleague David. David, would you like to introduce yourself?
Sure. Thanks, Maya. Hi, everybody. If I haven't met you yet, David Opongwadi, Manager of Legislative and Political Affairs with ASCA. And we really look forward to providing you with a meaningful opportunity to connect with your federal legislators and their staff.
David and I are here today to provide some information about National Advocacy Day to help prepare you for your trip. The main asks of National Advocacy Day are to support our legislation, the Medicare Beneficiary Copay Fairness Act, and to invite the lawmakers and their staff to attend a tour of your facility. ASCA will be scheduling meetings for you based on the information you submitted in the registration form using your home or facility's congressional district. Attendees will be divided into groups by state or region. More information about your congressional meeting group will be sent a bit closer to the event dates. Meeting times may vary by group, but be prepared to have meetings scheduled throughout the day, starting at 9 a.m. and ending at 5 p.m. Congressional offices typically only confirm meetings about a week to a few days in advance, so once ASCA has finalized your schedules, you will receive an email with your assigned offices and group leader. Now, I will turn it over to David to talk a little bit more about our federal legislation, the Medicare Beneficiary Copay Fairness Act.
Thanks, Maya. So just to give everybody a little bit of background, we spent the past few Congresses canvassing committees of jurisdiction, that being Energy and Commerce, Ways and Means in the House, and Senate Finance and Senate Health, to solidify our approach on a particular provision from the larger Outpatient Surgery Quality and Access Act, that being the copay cap legislation that we've now introduced as HR 3006 or S1776, the Medicare Beneficiary Copay Fairness Act. 25 years ago or so, the Social Security Act was amended to make all outpatient services capped for Part B Medicare patients at the same amount as the inpatient deductible. Well, now that we have been able to, through innovation and technological advancement, get ASCs into a position where we can do a lot more complex procedures, we're looking for the exact same cap to exist in our setting. And so it's currently set at $1,676 every year. And we would like to see that exact same cap for Part B Medicare patients to be able to access ASCs. We know that ASCs charge about half the cost for the exact same procedures. And so there's potential for huge savings in the future if we're able to shift just enough volume. But more importantly, thinking about patient access, we understand that for patients who are 65 or older and are, just above that Medicaid line, a few dollars can make a huge difference in their willingness to access an ASC, particularly considering the cap already exists in the higher cost setting, the HOPD. And so, we understand that there is a broad group of people across the aisle who are willing to look at this particular issue, and we need your help in getting the word out on this particular bill so that we can move it forward.
So, what can you expect in these congressional meetings? Each group will be led by either a state association leader or a member of ASCA staff. Each group leader will check to make sure that everyone arrives on time to their scheduled meetings. While meetings will be scheduled in space to ensure that every group has sufficient time to travel to their next meeting, security measures around these buildings have been increased, and you will need to go through security before you enter each building. So please make sure that you allot enough time to do so. Once you clear security, you can follow your group lead to an elevator or walk to the room number for the meeting. The group lead will direct you through the best ways to get to each office, as the numberings can sometimes be confusing. Groups can also use the tunnel system under the congressional office buildings when appropriate, which will help reduce the number of times you have to clear security. You may notice that each office building has a particular theme or floor color. However, each office looks very different. Many times during congressional sessions, a legislator may not be able to attend a meeting as they have a tight voting schedule that often changes. So you will most likely meet with staff instead. Meeting with congressional staff is a vital component of advocacy and just as important as a member-level meeting. The staff help choose the legislation their boss sees, and they directly advise their bosses and hold sway over how they should vote. If you're scheduled to meet with a certain member of the staff, be mindful that assignment may change at the last minute. We must remain flexible as other parties will also be meeting with the various offices. If you haven't been to Capitol Hill before, you may be surprised by how small many of the offices are. The office space may not offer a ton of private room for our meetings, so you may be meeting in the office, but you could also be standing near the reception desk or even out in the hallway. Meetings may also run shorter or a bit longer than the original scheduled time, but my advice is to go into every meeting with an open mind and to be adaptable to last minute change. Even the shortest meeting in a hallway can make a lasting impression on a lawmaker or their staff.
ASCA will provide each attendee with background information on each member of Congress you'll be meeting with, along with the current co-sponsor list of the Medicare Beneficiary Copay Fairness Act. If you have a personal connection with the lawmaker, great. Or if you've met them before, it's always a great opportunity to mention that in the meeting. Additionally, if you have any local tie-in, news, or events in the community that you must bring to the member's attention, this is a perfect way to start the conversation and to engage his staff or her staff on the particular issues that are happening back at home. We suggest taking a few minutes before your meetings to look through the talking points and summaries of the legislation, which will be provided for you. As a group, decide who is the most familiar and comfortable with the legislation that would like to discuss it during the meeting, along with any other issues you would like to bring up as a group, and as well as who in the group will ask the member of Congress or their staff for their support directly. For lawmakers that are already co-sponsors of the bill, we simply ask that you thank them for their support. Now, for the meeting itself, start each meeting by having every member of the group introduce themselves and state that you are the Ambulatory Surgery Center Association and here to discuss the state of the surgery center community and the Medicare Beneficiary Copay Fairness Act. We suggest also asking how familiar they are with ASCs in general to help avoid any confusion and to see how knowledgeable the member of Congress or their staff are. As you all are probably very familiar with, many lawmakers remain uninformed or underinformed about not only ASCs, but the issues that are currently impacting our ability to provide care. Or they may have not even been to an ASC before, and so they would need us to kind of lay out a setting and give them, direct examples before moving on anything legislatively. Overall, let's make sure that we tell our personal stories as well as the story of ASCs. Make sure you allow enough time for everyone to speak and cover the topics you would like to discuss within the allotted meeting time. Please try to be concise. We know that sometimes it's easier said than done, but it's also okay if you need to read off the talking points to make sure that you stay on point. It's also helpful when discussing the legislation if you're able to connect how the Medicare Beneficiary Copay Fairness Act would affect your patients, the lawmakers' constituents.
We'll next go over a few quick do's and don'ts. These are probably all common sense to you, but we are just offering a friendly reminder for everyone to keep in mind. Please do not talk about campaigns, fundraisers you may have met a member at, or giving money to a campaign during your meetings. Don't comment about the staffer's age, the lawmaker's politics that are unrelated to ASCs or healthcare, or assume their level of knowledge about ASCs. Please try to avoid giving long-winded answers to questions as your meeting time may be limited. And finally, if you do not know the answer to a question, that's okay. We do not expect you all to be legislative experts, but please do not make up an answer. If you do not know the answer to a question, or if the member or a member of staff has a request, please note the question and let the office know that ASCA staff will follow up. And what to do. Remember your talking points and ask for support for the Medicare Beneficiary Copay Fairness Act. Be on time to your meeting, patient, and adaptable to any changes. Explain the story of your ASC and what issues are currently impacting your surgery center's ability to provide care. And most importantly, we want you all to enjoy these meetings, have fun, and we encourage you all to take pictures throughout the day. In terms of follow-up for each meeting, please thank the staffer or the lawmaker for their time. ASCA will follow up with each office to say thank you and provide copies of our materials. We will also answer any questions that they may raise with you in our follow-up. If you'd like to thank the member of Congress or their staff yourself directly, you can do so in the email that ASCA will send to the office, or you can do so on any social media platforms by tagging the official. Please feel free to share your photos of the event on your social media channels and tag ASCA's account, or you can send them to me directly. I hope that we covered many of your questions in this short video, but please feel free to reach out to David or myself at the emails included. ASCA will also be having an in-person training and Q&A before your day of meetings. Please stay tuned for emails with updates, more details, and information about National Advocacy Day. Thank you again, and we look forward to seeing you in DC.